Okay, some people say that more you rest a shoulder injury, the stiffer it gets. That's confusing.
So post-injury, anybody would give rest. But shoulder is a different kind of a joint. It is little sensitive joint. If you rest too much, not doing activities, not moving your, because it's a 180-degree joint. So if you have a pain when lifting and you avoid lifting and do simple activities, that movement starts getting restricted. So it's called stiffness of the shoulder.
Okay, so if you're not doing any activity and it's still paining, that's when you
That's called as resting pain.
Resting pain.
Resting pain is it's a cutoff point. That means
you have to visit.
Yeah, you have to. Better to visit. Finally, he came after 6 months continuous pain to the shoulder. We got an MRI done. The biceps muscle was completely damaged and it was about to get torn. Most of the activities, IT people who sit have a lot of slouching posture. Shoulder starts drooping forward and we sit like a C. We lose the ability to sit straight. So, doing activities, just lifting anything in this wrong slouching posture, the angle of muscle thing will be wrong and it leads to pain.
You are tuned in to Fever 104 FM with me, Cheyenne, on the Superhero Show, and every Thursday between 6 to 7, it's time for Health Waves, courtesy Kauvery Hospital, Marathahalli. So while I am doing this on my radio show on audio, it's also being videographed, and as a guest joining me from Kauvery Hospital, Marathahalli, is Dr. Kiran Nagaraj. Sir, first of all, thank you so much for taking time out and coming to our studio.
Thank you.
Sir, before we go ahead, if you could kindly introduce yourself for our listeners.
Myself, Dr. Kiran Nagaraj. I am senior consultant in Kauvery Hospital, Marathahalli.
Okay. As soon as you came in, as soon as I read what the topic of the conversation would be today, I was overjoyed because I got some free consultation. We are talking about shoulder pain. A lot of people suffer from it. A lot of people complain about it. What are the most common shoulder problems you see? Let's talk about that.
See, shoulder pains are becoming more common nowadays.
Right.
Earlier, pains were pretty much less. Nowadays, because of using of racket sports like badminton, people are more into the gymming activities, lifting weight.
Right.
And also because of the wrong posture while sitting, so they do exercises in the wrong way and start getting small kinds of pain, which gradually build up on it and finally lead to a muscle tear or arthritis of the shoulder. So initially, we have to be very careful how we pains starts and how when we should consult the doctor.
Okay, so but most common shoulder pains that you see are from people playing sports
Most common
and gym.
pain will be more from female actually, more than the gym and athletic persons, because of too much of cleaning, too much of washing clothes. And so the female population is the one which has more pain. Preponderance of pain is more in females. Males, particularly who are into weightlifting and badminton sports, will be having pain.
Okay. Now, I've heard people say that they, there are sometimes they get so much pain that they couldn't even wear a t-shirt or, comb their hair. The arm stops moving past a point. I mean, how does that actually happen?
See, shoulder is like a ball and socket joint. So, ball is there and it's a T.
Right.
It has a covering of rotator cuff around the shoulder that circles the bone. So, that is the muscle which lifts the arm. So, overactivity or anything, any inflammation or any minor tears, people will have difficulty in lifting the arm. So, putting a t-shirt, even combing your hair, taking some thing from the upper shelf, all these things, simple activity, people start getting pain. And finally, sometimes they may not be able to lift the shoulder also if the problem is more. So, initially these simple things, simple activities give rise to pain.
Okay. Now, when people go through these pain, not everybody comes to a doctor. Like I was telling you myself that I was considering coming to a doctor. I have not done that. Some people, rub a balm, some people pop a tablet and they keep pushing through. Is that okay or is that making things worse?
For every pain, you might not have to consult a doctor. Say low grade pain, which improves with rest and icing or a local balm, it should be enough. Persistent pain beyond 4 weeks and particularly pain associated with lifting, difficulty in lifting the arm, difficulty in doing your routine activities, difficulty in playing racket sports or lifting weights, then we will have to visit the doctor. For up to 4 weeks, low grade pain without significant restriction of activities, no need to visit the doctor. Give rest, put ice packs, ice helps in healing, and wait for that.
Okay. Now, I have seen people who say that the shoulder issues started from simple things like lifting bags or sleeping on one side, bad posture. So, can day-to-day habits really lead to serious problems? And how do you know when it's more than maybe just a strain?
See, others pains are more nowadays because of the wrong posture. Because most of the activities, IT people who sit have a lot of slouching posture, where we shoulder starts drooping forward, and we sit like a C. We lose the ability to sit straight. So, doing activities, just lifting anything in this wrong slouching posture, the angle of muscle thing will be wrong, and it leads to pain. So, rotator cuff pain, biceps pain, all the muscle will be put under undue stress. So, putting the posture and doing the activities will be helping the muscle for restricting the pain. Pain associated with restriction of you're not able to lift the hand, you have a numbness, you are not able to sleep on the side, there is restriction of movements, you will not be able to do 100% of the movements, then it's a time to visit the doctor.
Okay, so I've got this friend who has been complaining about a dull ache in in his shoulder. It keeps coming. It sometimes is not there, and the person has been brushing it off. So is that the kind of thing that people should get it checked sooner?
Are you talking about yourself?
No, I'm not. Mine is persistent when I'm working out.
Only on working out. Yeah.
Right.
See, pain not even on working out, just sitting, when you're sitting and just watching TV, eating food, even when you're not working out and you're having pain, it is indicative of a more
deeper
problem. Pain on activities, particularly lifting heavy weight or doing gymming activities, a low grade pain. That is indicate only pain on when you're putting stress on the muscle. But resting pain is a bad thing. So that is a very cutoff point where you should have a consultation with the doctor, have a checkup, and see what is happening inside the joint.
Okay, so if you're not doing any activity and it's still paining, that's when you
that's called as resting pain.
Resting pain.
Resting pain is it's a cutoff point. That means
you have to visit
you have to better to visit the doctor. And
better late than never. Okay, some actually not better late. I mean better sooner than pretty late. Okay, some people say that more you rest a shoulder injury, the stiffer it gets. That's confusing.
Yeah. See, what do you do after any injury? That is a simple mnemonic called RISE. Rest, ice, compression and elevation. So, post-injury anybody would give rest. But shoulder is a different kind of a joint. It is little sensitive joint. If you rest too much, not doing activities, not moving your, because it's a 180-degree joint. All the other joints are 90-degree joints, 120-degree joints, but shoulder is a 180-degree joint which has complete movement. So if you have a pain when lifting and you avoid lifting and do simple activities, that movement starts getting restricted. So that's called stiffness of the shoulder.
Right.
So how to we have to give rest and you have to do the mobility also. What I would suggest is do passive movements. There are two kinds of movements, passive and active. Passive is supported movements using your own help of the hand or a stick, using the help of a wall. Simple activities can be done. Active movement, you only doing lifting the shoulder and moving the hand should not be done. So keep the joint mobile and as well as give the rest to the joint. So injury time you should be doing passive movements initially. Once the pain goes away and the tissues heal, you can start doing active movements also.
Okay. Can you share an instance of somebody who is probably not an athlete, normal person who's gone through a shoulder issue and a serious one at that, and has resumed being active in his or her or their life?
One of my patient was there. His name is also Kiran, and he was a young person who is into IT, occasional cricket player. He plays cricket, but not extensively. It's not. He's not a full-grown athlete. He had persistent pain, resting pain, which I was suggesting earlier. For long duration, he didn't meet. Finally, he came after 6 months, continuous pain to the shoulder. We got an MRI done. The biceps muscle was completely almost damaged and it was about to get torn. So, had to do a procedure on him did the repair of the biceps muscle. Now he's gone back to his shoulder. He likes playing cricket, and I didn't want him to
Stop
playing that. So after the surgery, once repair is done, he has gone back to his. So it's a just he didn't had any significant problem. His thing he was able to move, he was able to lift weight. His only complaint was persistent pain. Continuous pain without any break. So that's called resting pain. So muscle was gradually getting damaged. The tendon was gradually getting thinned out, and it was like how a chappal gets
worn out.
The tendon also was getting worn out because he was not maintaining the postures properly while bowling or while throwing the ball and all. So after the surgery, he went through good physiotherapy. Now he is back into cricket again.
That's a happy,
and he's happy.
That's a happy ending a pretty painful story, maybe.
Yeah.
I want to ask you, what is this? We've heard this term, a lot of people use it, called frozen shoulder. Can you tell us what is frozen shoulder?
Frozen shoulder is a common thing. People don't know much about it. See, frozen shoulder means what is as the name implies. Frozen means like an ice. Joint starts to becoming stiff like an ice. Why it happens is particularly post simple injuries, or as I told you, simple tendinitis, inflammation will start developing. People start reduce the activities. If you have pain in lifting the shoulder, as we had discussed earlier, what you will do? You will restrict that activity. You will do simple whatever is not paining for you. You will do that activity and avoid lifting the hand per se. So gradually the stiffness starts. The muscle starts becoming tighter and tighter, and the muscle surrounding the joint become inflamed. So finally leading to a severe painful shoulder with restriction of movements also. That is called as frozen shoulder. Very, very common in old age people, very common in ladies, very common in diabetic people.
And how does one recover from that? Sorry.
So frozen shoulder, as I told you in the name itself, we have to start the physical therapies for. We have to first identify what is the cause. If there is a tear or just a plain frozen shoulder secondary to diabetes, where there is no tear, there is no injury to the muscle, nothing is there. It's a pure frozen shoulder because of diabetes or hypothyroidism. Both can cause a frozen shoulder. There we start with physical therapies, hot water fomentation, physiotherapies, and sometimes we might have to give a injection shot into the shoulder joint to reduce the inflammation. There is a newer treatment called hydrodilatation and get the movements back. Shoulder manipulation we do, and finally some very rare cases we might land up in surgery to release the tight structures to get the shoulder movements back.
I was about to ask you that how many in cases of shoulder pain does actually move to surgery? You would say very less.
Very less. Actually, less than 10% of people would land up in surgery. Not everyone would require surgery. Most of the time, physiotherapy and along with supplements would be enough. Maybe 30-40% cases might require injections, but surgery will be less than 10, maybe 5 to 7% only.
So somebody walks into your cabin with shoulder pain. What are the treatment options like, let's say?
First thing is get your posture right. Slouching. This is
every time you say get your posture right, I am sitting straight.
You are now right. Yeah, very common because see, we all put load on the shoulder, but the base of the thing is scapula. That is the upper back muscle. If that is strong, load on the shoulder will be reduced. If that is weak, people are slouched like this and start doing activity, they will be in pain. Finally, they will land in muscle tear also, and finally land up in surgery also. So the first thing to be done is to correct the posture, treat the patient, how to lifting a weight, how do you have to lift the weight. You should teach the patient how do you do, and simple activity, simple exercises will start. Some local physiotherapy, supplements, all these things we will start with that. Now secondary thing, there are newer treatments for young patient who has a minor injury, minor tear which doesn't have to be operated. There are newer treatments called PRP injection. It's a platelet rich plasma injection, which is like a stem cell from your own body. We collect it and inject it, so it helps in healing the tissues. So these things can be done. Frozen shoulder, so many treatment options are there, as I have already discussed. Last, people who have a tear, complete tear, where the muscle, if there is a complete rotator cuff tear, it is not going to heal back. So you might have to do a surgery for that particular some patients, some set of patients, not for everyone. If the tear is very bad, if you are throwing a ball and suddenly pops out, you have an injury, there will be tears in the muscle, then you will have to do. For low grade, slowly, gradually developing, most likely you will not need the surgery. There you can try all these methods, try to get back to normalcy.
Okay, so for people who are into sports or for people who are working out and stuff, what is, and normal people who are not professionally into any of these, what would you advise them? How can they take better care of their shoulders? Because shoulder pain is very common.
Start with exercises, body weight exercises. I would suggest push-ups, pull-ups are very, very important. As if you are into sports, try to do. So that corrects the posture or as well as strengthens the rotator cuff. First thing is that, so particularly sports injuries, particularly in throwing activities. Shoulder gets injured in throwing activities, bowling or throwing a ball to the wicket keeper. Common in cricket is common in India. So you have to, the rotator cuff is the main muscle which does that. So if you have to prevent injuries, try to warm up little bit initially, stretch yourself, regularly do the exercises, maintain the posture. For people who are into weightlifting, that is a different thing. Trainers are there nowadays. Be careful in how you lift. Try to, if you have a pain, try to reduce the weight or try to reduce the repetition of the pain. So don't push your body too much, so the pain lingers on a lot. Try to go one step down. Try to relax, reduce the, continue your activity. Don't completely stop it. I don't want to stop activities, but slowly go down and gradually increase it. Increase the strength. Gradually doing, increasing your strength and flexibility will avoid injuries.
Okay. One last question before I let you go.
Yeah.
As a doctor who treats shoulder injuries, amongst other things, what is the best shoulder exercise that you would recommend to people, both for people in the gym and people who are into sports?
As I told you, push-up is the best exercise.
Push-up.
Push-ups, correct push-ups. And also stretching exercises, particularly scapular exercises, which you have to tell them by doing it. Very difficult to tell like that.
Okay.
And don't do just rotational activities. Those things will cause injuries. Always do exercises with some support.
Okay.
You can do a wall push-ups. People who can't do normal push-ups, you can do a wall push-ups and try to get the shoulders back.
Okay.
That is more important.
So those kind of push-ups correct your posture of shoulder
proper.
as well, and then maybe you can get
Yeah,
into
just
other kinds of
wall push-ups will get your shoulders back and correct the posture as well.
All right. Dr. Kiran Nagaraj, thank you so much for coming
you.
to our studio. This was a very insightful session, and we talked about something that a lot of people suffer from. So thank you so much, A, for coming to the studio, and B, for giving me a free consultation in the studio.
Thank you. Thank you, Shayan. Nice meeting you.
Nice meeting you too,
Nice
sir. Thank you so much.
Thank you.